Let's talk about preparing for home. Make sure you have someone that can drive you home from the hospital. Most patients are discharged by 11 a.m. You should begin preparing for your after-hospital care before you come to the hospital. If you are over age 70, live alone, or have limited home support, or use a cane, walker, or wheelchair to move around, you may need to go to a rehab facility after surgery. There are several rehab facilities that work with patients that have had your type of surgery. Talk with your surgeon about those options before you come into the hospital. These facilities will be able to communicate with your insurance company to get the process started even before the surgery. A care manager or social worker will visit you the day after surgery to talk with you about your discharge needs. They can help you with home or rehab arrangements. All care provided after you leave the hospital will depend on your surgeon's recommendations. Your insurance company also has coverage limitations. Your care manager and/or social worker can help you with this process. There are some important things you need to know to take care of yourself after you leave the hospital. Care of your incision is very important. If you have stitches or staples in your incision, you cannot get your incision wet. You may cover your incision with a waterproof bandage to shower or bathe at the sink. Change the dry gauze daily. For any type of incision, never submerge your incision under water. Check your incision daily for redness, swelling, or drainage, and notify your surgeon if this occurs. And if you develop a fever greater than 100.5, notify your surgeon. You may be discharged with a prescription for pain medicine and muscle relaxers unless these are being prescribed by another physician. Make sure and notify the surgeon's office at least 3 days in advance when needing a refill to make sure you have the medicine you need. When you are discharged from the hospital, you will be given instructions about when to make your follow-up visits. You need to make these appointments soon to make sure you see your surgeon at the correct time. At this time, the surgeon will tell you when you'll be able to resume normal activity like driving, going back to work, etc. If you have questions about your recovery or something that doesn't seem quite right, call your surgeon's office. There will be someone who will be available to answer your questions or concerns.